Now let's move on to talk about ultrasound imaging in gout. To do this, we will discuss the revision and update made by Euler thoroughly in a comprehensive manner based on the evidence presented in 2018. They established 8 recommendations, and it's interesting because all 8 recommendations, especially point 5, it talks about imaging telling us that in those patients where the diagnosis of gout is uncertain and crystals cannot be seen, like in the clinical case we presented, imaging can help us detect that crystal deposition and observe its characteristics to establish an alternative diagnosis. And along those same lines is point 6 of those 8 recommendations. They tell us that plain radiography could be useful to see evidence of crystal deposition, but it has limited diagnostic value for flares. It's more useful for identifying chronic changes. However, in that same point, they tell us that ultrasound can indeed be a useful technique for diagnosing the patient, especially when there is a suspicion of gout flares or arthritis. To that end, they talk about the OMERAC group, which is the outcome measures in rheumatology group. They established 4 ultrasound features that we should look for in patients to reach a diagnosis of gout. The first of these, and the most specific, is the double contour sign. The double contour is graded from 0 to 3 in a semi-quantitative manner. In the first scenario, we would see a normal patient, one who does not have that feature, that double contour. And in the most severe grade, we would see a hyperechoic image that overlaps the bone cortex, which is what we refer to as double contour, which illustrates the deposition of crystals that accumulate on the articular surface. We should also carefully and meticulously examine for tophi, which are also graded from 0 to 3, where we see, in this case, on the surface of the joint, a deposit once again of uric acid, in this case in the form of a tophus. The other feature they also describe are aggregates, which are these speckled areas we can see in the image. And finally, they talk about erosions which, although not specific to gout, also provide clinical information and add value to the diagnosis. In this image, indicated by the arrow, we can see that irregularity in the bone cortex, which represents an erosion.